Hello and welcome to this presentation for the Society for Oncology Massage. My name is Nicola McGill and I am honoured to be able to speak to you today with the presentation that I would like to present on unravelling the lymphatic web. So my name is Nicola McGill. I am a manual lymphatic drainage therapist. I'm also a certified lymphedema therapist and I'm also an instructor for the MLD certification program with close training and consulting. And it's my honour today to be able to talk to you on behalf of the Society for Oncology Massage in bringing together and bringing some information to you on the lymphatic system and the importance of manual lymphatic drainage for the cancer patients. So many of you may already be aware of the functions and the workings of the lymphatic system, and some of you may also be fully aware of the importance of manual lymphatic drainage for the cancer patient. But what is important is that we understand the dynamics of the lymphatic system and how the dynamics of the lymphatic system can change when a person has gone through many of the different levels of cancer treatments, such as surgery, radiation, and even to a certain extent chemotherapy, and the power of the chemotherapy on the different systems in the body, such as the cardiovascular system as well as the kidneys. So before we start, I just want to cover some of the objectives that we will be discussing throughout this presentation. I'm going to review the basic anatomy and the function of the lymphatic system. It's also important to understand the use of effective MLD techniques. We're also going to be discussing the role of inflammation and how inflammation can impact lymphatic function and how chronic inflammation can reduce the function of the lymphatic vessels. And we're also going to discuss the role of MLD to help the oncology client. And often the oncology client, they receive treatments that can dramatically impact their overall lymphatic function. So those are the objectives. Now we can move on to briefly having an introduction into the anatomy and the physiology of the lymphatic system. So you can see here from this slide that we have a variety of components that make up the lymphatic system. Often people don't really recognise the full role and the full workings of the lymphatic system, and a lot of the times you'll hear people talk about the lymphatic system having a role in the detoxification process, which to a certain extent it does. We have to look at all the different systems of the body that have play an important role in detoxification. But the lymphatic system is made up of several components that enable the removal of fluid within the tissues, which is again part of a detoxification of your tissues, but it also plays an important role in immune function as well. But what you can see here from this illustration, the components of the lymphatic system are made up of a variety of lymphatic organs as well as lymphatic vessels. The lymphatic vessels and the lymphatic nodes are the key components to the lymphatic system that are responsible for the movement of lymphatic fluid. Some of the other components of the lymphatic system, such as the thymus, the spleen, your bone marrow, your Peyer's patches, which are located in the small intestines, as well as the lacteals, they're more lymphatic organs that are mostly responsible for the immune function role that the lymphatic system has. So your thymus gland is called a gland because it also secretes some hormones, but it's actually located to the left side of the heart, and it's an area of cell-mediated immune response and actually decreases in size as from childhood up and towards puberty. We have the spleen, that's also a very important lymphatic organ. And that is a reservoir for your white blood cells, red blood cells, and also plays an important role in iron metabolism. Your bone marrow is what produces your lymphocytes, so your B lymphocytes and your T lymphocytes, which again are very, very important in immune function because these are the cells that often reside within the lymph nodes, and it is here that they're often educated from the foreign particles and the antigens and the antibodies that we need for our immune response. Your lacteals are lymph structures that can be found in the small intestine as well as the Peyer's patches. The Peyer's patches are more responsible for immune surveillance, whereas the lacteals are lymphatic structures that are responsible for the absorption of fats and fat-soluble vitamins as a result of the digestion of those macronutrients. Tonsils are also a lymphatic organ, and they, as we all know, they're located in the neck. We have 3 levels of tonsillar tissue, and these again are very importantly located in the forefront of where our exposure to the outside environment is. It's also there to help protect the digestive tract as well as the respiratory tract. But what we're going to be mostly focusing on when we're using the application of manual lymphatic drainage is the lymphatic transportation network. So the transportation of the lymph fluid that's formed in the tissue spaces or the interstitial space, that needs to be transported and returned back to the main circulatory system. And so the vessels and the lymph nodes are responsible for that, and that's what we're going to be looking at further. So let's have a quick overview of the functions of the lymphatic system. And when I'm seeing my own clients, I always like to explain to them what is the role of their lymphatic system, because the lymphatic system, like I said before, often people think it's to do with detoxification, but it has some very, very important roles that's often misunderstood and underestimated. One of the functions of the lymphatic system is to prevent edema by returning protein and water from the interstitial space back to the cardiovascular system. Now, some of you may be wondering, what is the interstitial space? The interstitial space, also known as the interstitium or the extracellular matrix, is that area that surrounds our tissues and our cells that acts as a support and often as a medium for the transference of nutrients from the blood capillaries that contain all the essential nutrients for cell metabolism. And then the cells uptake all the nutrients that they need, and as a result of cell metabolism, excrete their waste into this area so that then the lymphatic system can pick it up and return it back to the cardiovascular system. Now, what's in the interstitial space is a combination of collagen fibers, fibroblasts, you get water, you get larger protein molecules. All of those particulates need to be removed from the interstitial space, because without that, our cells would almost suffocate in their own metabolic way. So this is where the lymphatic system becomes hugely, hugely important. So what happens is the protein and the water that ends up being within the interstitial space is returned back to the cardiovascular system by way of these small lymphatic vessels that can be found in the interstitial space, and it will then return the proteins and the water and all the other particulates back to the cardiovascular system. It's important to understand as well that without the lymphatic system being able to carry out this task, we would not survive within a 24-hour period, because our body needs to recirculate, recycle these proteins. So we need that recycling of the proteins in order for the human body to survive. What I mentioned before about the lacteals, which are located in the small intestine, are these lymphatic vessels that absorb the fats and the fat-soluble vitamins as a result of our digestion, so that they play a very important role, really, with the digestive function of the human body. The other important thing to remember about the lymphatic system is it has a very important role in immunological function. So it supports and it works as like a surveillance system, so it recognizes and it responds to all the foreign particles that enter into the body. So things like viruses, bacteria, cancer cells. It's very important in recognizing cancer cells that need to be eliminated and goes through the process of being destroyed. So it's really important that our lymphatic system is healthy, because that will enable our immune system to also be healthy. So now I want to talk a bit about lymphatic fluid. So lymphatic fluid is the fluid that ends up being in the interstitial space or in the interstitium. As I mentioned previously, the blood is circulating around the body constantly to provide our cells and our tissues with the essential nutrients, such as oxygen, water, proteins, fats, hormones, all the different macro and micronutrients that are broken down as a result of digestion in order to get to the cells. Now, this fluid is in the interstitial space gets there because of the movement of the blood passing through the blood capillaries. So at the blood capillaries you get this movement, which is also known as diffusion. It's an important process to move the fluid and the nutrients across into the interstitial space for the cells. Once it's there and the cells have used up whatever they need, they eliminate what they don't need, and then you're left with this combination of lymphatic fluid. And lymphatic fluid is actually made up of a combination of proteins, fats, water, and cells. What I'm going to show you now is a philosophical description of lymphatic fluid by a gentleman known as Thomas Mann, and he wrote the book The Magic Mountain in 1924.
The lymph, that is the finest of all, the most intimate and most delicate in the entire workings of the body. Always the talk is of the blood and its mysteries. It is called a special humour. But the lymph, that really is the humour of humours, the essence, the cream of blood, a most delicious sap. Thomas Mann, The Magic Mountain.
So from listening to the verbiage here, we recognize that there has always been an important understanding of the lymph fluid, how important is the particulates that it contains are very important and very closely linked to the blood circulating around the body. So this is another area where I think with manual lymphatic drainage, it's a modality that can help us move and enhance the movement of this essential lymphatic fluid back into the cardiovascular system that's really very supportive in overall health and well-being. So now we know that in the interstitial space is this lymphatic fluid. This lymphatic fluid needs to move out of the interstitial space and get back to the cardiovascular system. So the lymphatic system is not a circulatory system. It is a one-way system that absorbs fluid, transports it back to the cardiovascular system. It then ends up being back and becoming part of the blood plasma, and that's it. So we need a system that's designed, and fortunately we have an amazingly designed lymphatic system that can absorb that fluid from the interstitial space, and then it can be transported back to where it needs to go, which is the cardiovascular system. So the initial place of absorption of that lymphatic fluid is in the interstitium, and what absorbs this fluid is a lymph capillary. Now these lymph capillaries, they are located in the superficial areas of the skin. They are completely different to a blood capillary in their structure and also in their size. They're much larger than blood capillaries because they have to absorb these larger molecules that end up being in the interstitial space and in the tissues. And their structure needs to be slightly different so that they have this mechanism of opening and closing to allow the fluid and the larger molecules to enter into the system. So they absorb the interstitial fluid and then they transport it to larger lymph vessels known as lymph collectors. They then lead to lymph nodes where lymph nodes actually filter this fluid before it gets back into the cardiovascular system. So with the lymphatic capillaries, closely located by the lymphatic capillaries, dendritic cells can be found, and dendritic cells act as little transportation molecules for antigens that are circulating around in the tissue. They pick up these antigens and then the dendritic cells travel through these lymphatic capillaries into the lymphatic vessels, and then they enter into the lymph nodes where they're then presented to the B cells and the T cells. So this is how sometimes immunity within the lymphatic capillaries also works, not just in the lymph nodes. So the lymph capillaries absorb this fluid out of the interstitial space, and then this fluid now has to have a mechanism in order to move the fluid most oftenly from a proximal distant presentation to distal. And so we need a structure within the vessels that are actually going to be able to move the fluid in this direction. Now with this illustration, we're talking here a little bit more about the deeper drainage of the lymphatic system. What we spoke about just now was the superficial drainage with the lymphatic capillaries with the absorption, and then as this fluid is absorbed, it then needs to go into these deeper lying vessels that transport the fluid towards the lymph nodes. So in this first illustration, you can see the small lymphatic capillaries that then lead to the deeper lymph vessels. And this is where cellular waste and excess fluid and the water that ends up into the interstitial space have drained further into the deeper vessels. And the deeper vessels, known as lymph collectors, these collectors are then structured in a way so that they contract and relax to move the fluid from a more distal to proximal presentation. When this fluid is in these lymph collectors, it's then transported up towards a group of lymph nodes, and these lymph nodes will then filter the lymphatic fluid. So the lymph node, as you can see in this diagram here, is kind of very similar to the design and the shape and the structure of a kidney. And as we know, kidneys filter fluid from the blood, and your lymph node is filtering your lymphatic fluid. And so the lymph nodes are located in groups. We have groups of them in the armpit area, which is known as the axilla, or in the leg area, in the groin area, which is known as the inguinal group of lymph nodes. We also have a variety of them within the head and neck area. But what you can see from this diagram is that these lymphatic vessels lead into the lymph node, and we see more lymph vessels entering into the lymph node than those leaving the lymph node. Because again, the lymph node is responsible for the filtration of all that fluid that comes in. It regulates the content of the protein and the water so that when it leaves the lymph node, it's the right consistency in order to pass through all the way to the rest of the vessels, and by the time it gets back into the blood circulatory system, it's a completely different consistency than from where it started. Now, when we talk about the return of this fluid back into the cardiovascular system, you'll see from this diagram here that the return of lymph and all the different cells within the lymph goes back into the supraclavicular vein on either the left or the right side of the body, and that's where it enters into the cardiovascular system. So all lymphatic fluid does eventually return back to the cardiovascular system by way of the venous return as opposed to the arterial side of the cardiovascular system. So just know that it always goes back into the veins, and it's important to recognise when we do manual lymphatic drainage that we always start our sessions by working in the neck area, and this is because we want to empty any fluid, clear an area of that final place where the lymphatic fluid is going to return. If this area is full, it's a lot harder for us to return the fluid with our manual lymphatic drainage skills. So a lymphatic collector, or this larger lymphatic vessel, is where we now start to see our direction of lymphatic flow. Due to gravity, if we didn't have this definitive structure to a lymphatic collector, then fluid would not be able to move. We don't have a centralized pump to the lymphatic system like we do with the cardiovascular system. With the cardiovascular system, we have that pump, we have that pressure that enables the force and that movement of our fluid throughout the system, but the lymphatic system doesn't have that. So it relies upon the unique structure of our lymphatic collectors that are able to contract and relax and contract and relax to get this kind of sequential movement of the lymphatic fluid, most often from a distal to proximal presentation. So as you can see from this diagram, it's not one kind of straight channel of fluid that moves. These lymphatic collectors are broken down into little segments, and these segments are known as lymphangions. And a lymphangion can kind of be described as one functional working unit of a lymph collector. So a lymph collector is made up of several lymphangions. And hopefully you can see this from the illustration as well, that these little segments are really basically the distance between the valves. So these lymphatic collectors do contain valves, and they are important to prevent backflow, but are also very important to enable that sequential movement, like this pulsation, the movement of the fluid from a distal valve to the proximal valve. This contraction is actually regulated by the autonomic nervous system. So when there is an increase in lymphatic volume within these lymph collectors, we get a contraction that projects the fluid from one section to the next section of this lymph collector. And this is often seen in textbooks or known as lymphangion pulsation. Some people refer to these little lymphangions as lymphatic hearts. In general, these lymphangions contract at approximately 6 times per minute, but can increase up to 20 times per minute, depending on the volume of lymphatic fluid that's located within these lymphatic collectors. So what we can do with manual lymphatic drainage is we can enhance the movement of this fluid through these lymphatic collectors, which under most normal circumstances, when we don't have any build-up of fluid within the tissues, when we don't have any edema, we're just really, supporting the movement of this lymphatic fluid that may contain a lot of immune-fighting cells and waste products that we need to get out of the tissues. It's moving it back into the system more quickly and effectively. But again, when you've got a build-up of fluid in the tissues, let's say we have edema as a result of a surgery or some kind of trauma or a reaction, an allergic reaction kind of thing, we can enhance the activation of the lymph fluid and the movement of that lymph fluid with our manual lymphatic drainage, which we're going to see shortly in further slides. Now, there are a lot of factors. We have what we call intrinsic factors and extrinsic factors that can move lymphatic fluid. Intrinsic would be the activation of the autonomic nervous system in a response to this increase in lymphatic fluid within the vessels. So when there is that increase, then the lymphatic system is like, okay, let's contract, let's get this fluid back to where it needs to be. So let's talk about lymph nodes. Lymph nodes are these little mini kidneys. They are important for, as I mentioned earlier, for filtering lymphatic fluid that's collected from the interstitium. And, if you think about it, if you think of all the metabolic waste that's being collected from the extracellular matrix, that interstitial space, we don't want that going straight back into the cardiovascular system. We want it cleaned, we want it filtered, we want it purified. So this is where our lymph nodes are very important at doing that. And again, we do have clusters of them. They can be clusters within the leg, the top of the leg, and the inguinal lymph nodes, and the armpit, which are known as the axillary. We have a wide variety of them in the head and neck and face region, as well as a huge amount in the digestive tract too. We have approximately 600 to 700 of them in the body, and a lot of time, I remember when I was younger, you'd go to the doctor and if you'd have a sore throat, you'd feel a little achy, and the doctor would just kind of palpate he would call them your glands, but they were actually your lymph nodes. And your lymph nodes are very important in your immune response. And when they are tender and when they are a little, maybe possibly a little swollen, that's because they're active. They're actually doing their job, and that job again is very important when it comes to immune function. And like I mentioned earlier, the lymph nodes also they store your lymphocytes, your B cells and your T cells, and they are there ready, waiting to be activated to respond to any foreign particulate that comes into the lymph node. It will hold on to it. Macrophages will come in and destroy any of those foreign particles to prevent that then moving further through the body. So they are hugely responsible for immune cell education, because again, this is where the antigens come into those lymph nodes and then educate the B cells and the T cells, and really also very important in our immunological response. So now we're going to have the first of our polling questions. And again, this is just a little kind of bit of fun for you. So we're going to have another one before the end of the presentation. So what I'd like you to answer is, which of the following is not a function of the lymphatic system? Would it be 1, the prevention of edema in the tissue spaces? Or 2, does it promote inflammation? 3, does it play an important role in digestion of fats and fat-soluble vitamins? And also number 4, does it play an important role in immune function? Well, the answer is it does not promote inflammation. What the lymphatic system does, it can prevent the edema in the tissue spaces by returning that fluid back to the cardiovascular system. It plays an important role in the digestion of fats and fat-soluble vitamins, and it also plays a very important role in immune function. If anything, it can help prevent inflammation, or at least prevent inflammation from becoming chronic by moving everything out of the tissue spaces. Okay, so let's look at manual lymphatic drainage. What is manual lymphatic drainage? Now, I remember when I first started learning about manual lymphatic drainage, the words in itself were kind of, that sounds pretty complicated. But it is not complicated. It is one of the most gentle, nurturing modalities that I've ever come across and ever experienced, and I use it in my practice when I see my, not just my oncology clients, but also all of my clients that have conditions that I can really see where they could get the benefit from manual lymphatic drainage. There are a variety of manual lymphatic drainage techniques promoted throughout the world, but one of the oldest, long-standing, most widely researched method of manual lymphatic drainage is the VODA technique, which was developed by the VODAs back in the 1930s. And they studied the anatomy and physiology of the lymphatic system, and they developed these techniques which were designed to support the functioning of the lymphatic system. And the techniques are, they're gentle, they're rhythmic, and they are manual movements that are performed on the skin. And one of the things you'll see when we see the video shortly is how it's a very gentle stretching of the skin to actually activate the lymphatic vessels that we have been discussing. Again, following the anatomy of the lymphatic system is very important when working with manual lymphatic drainage, because we want to move the fluid that we're picking up from the interstitial spaces. We want to move it into these vessels that can then drain effectively into the lymph nodes and get that fluid back to the cardiovascular system. So the benefits of manual lymphatic drainage are often discussed in ways of with moving the lymphatic fluid. So enhancing the movement of the tissue fluid into the lymphatic system to return the fluid back to the cardiovascular system to prevent the edema. But it has so many other valuable benefits that can help not just your oncology client, but any client that's experiencing symptoms of, pain, nervous system issues, and anytime we have scar tissue, we can redirect using manual lymphatic drainage. So some of the benefits that I like to discuss with my clients and colleagues in why I use manual lymphatic drainage is that it acts as an excellent analgesic. So it's very, very helpful when you have clients that have a lot of pain. Often the pain can lead to more discomfort. It can lead to quality of life issues. So I'm always thinking about how can I use my manual lymphatic drainage to help my clients with pain. So it's a very beneficial analgesic. Thinking of again, when people are in pain, they may be taking more medication than they actually want to. So here is a modality that we can bring in to help support pain management. And it's not to say that we're replacing pain medication with manual lymphatic drainage. That again is obviously always down to the client and their medical team on how best they want to manage their pain. But it's a non-invasive, gentle approach to affecting the autonomic nervous system, because at the same time as it being analgesic, it is also very calming and soothing. So this is an area where, and I think because of the rhythmic action of manual lymphatic drainage, it calms and soothes the autonomic nervous system, so it can really be beneficial in conditions of like anxiety, stress, poor sleep, for example, is another area that we can use it greatly for. The other thing with manual lymphatic drainage, as we know, we have those lymphatic capillaries in the tissue spaces, and so by doing manual lymphatic drainage, we can help the activation of these lymphatic capillaries to absorb the lymphatic fluid. And then what we're also doing is, once we've helped the absorption of that lymphatic fluid and the fluid is now in the lymphatic collectors, our action with this gentle rhythmic motion of our hands can actually enhance the contractions of the lymphatic vessels and the contractions of those lymphangions. And we're going to see that in a slide shortly. The other benefit, the really great benefit to manual lymphatic drainage, is that when we have scar tissue or some kind of trauma to the tissue, often the lymphatic system is kind of sometimes temporarily, sometimes permanent, but it gets blocked. The flow of lymph gets hindered, and so scar tissue formation can actually grow and develop along these lymphatic pathways that can then cause a blockage of the lymphatic returning back to where it needs to go. So often you may see scar tissue that has edema in the area, and again that scar tissue is just really hindering the movement of that lymphatic fluid. What we can do with manual lymphatic drainage is to redirect that fluid around those blocked areas and divert that fluid into better functioning lymphatic vessels and move that fluid out of there. Thus that then reduces the level of edema. It gets that protein-rich fluid back into the cardiovascular system, and it can also help promote the healing response of the tissue that has been scarred or traumatized. So here we're going to take a look at some of the types of manual lymphatic drainage that you may come across, and I want to discuss with you the benefit of doing very effective manual lymphatic drainage. So in this first video you'll see, you know, it's very nice, it's very relaxing, it's a very soft, gentle touch, which, you know, for some of our clients we may think, oh, we need it to be gentle, but we want to have it gentle, but at the same time we want to be able to have purpose with it. We need to have that purpose of actually moving the lymph through the system, and a purpose of, you know, enhancing the action of these lymphangions and the contraction of those lymphangions. So what you can see from this first video in effective MLD is, yeah, it's a very gentle, nurturing kind of touch, but it's so light and there's not much contact. It's almost just like fingertip contact that is comforting. If I'm honest, I find if I was to do this on some of my clients, they'd find it very intrusive and not, you know, meaningful enough. But also what you can see from the hand movements here, it's just like a very, very light kind of effleurage, a feather-light touch that's just maybe just stimulating some of the circulation a little bit here. But we're not getting a lot of movement to the tissue, and it's just almost like a very, very light effleurage. Now when we look at the effective manual lymphatic drainage slide, you can see that we've got more of a full hand placement on the tissue, and that will help us achieve the stretching of the skin. And it's the stretching of the skin that is actually increasing the rate of absorption, because we're helping the lymph capillaries to open and close in order to absorb the lymphatic fluid. But then we're also having that contraction, relaxation movement on these lymphangions. So we're enhancing the transportation of the lymphatic fluid. And as you can see, like I said from this diagram, this photo, that we've got a whole hand being placed, kind of moulding our hands around the tissue beneath us. And that, in a sense, is just creating a comforting touch, but it's also being very purposeful. We've got a distinct purpose to moving that tissue. And again, when we have that connection to the tissue, we're also more aware of the direction that we're moving this lymphatic fluid. And I think that's another important thing to understand when we're providing manual lymphatic drainage, is that when we have this rhythmic kind of movement, it has a pressure phase and it has a relaxation phase. And the pressure phase is that phase of when, okay, this is where I want the lymphatic fluid to go. This is the direction that you need to go. And that's why it's important to have more of a full hand placement, so you really have got the lymphatic system thinking, okay, this is where I need to go. And then obviously the relaxation phase is very important, because that allows the refilling of the lymphatic vessels, particularly those lymphangians. So we need a certain level of pressure, and that pressure is required to support the mechanism of those initial lymphatics. So the other important thing to remember is that it's not the quantity of the strokes that you give, it's the quality. You can do numerous strokes with poor quality of the stroke and be less effective, whereas if you could do less strokes but have more quality strokes, then you would be getting a more definition to the movement of the lymph fluid. And here you'll see when we're working, for example, on a limb, you can see here it's almost like this very light feathery stroke that's not really moving the lymph vessels in an appropriate manner. And then from here you can see a whole hand placement. The whole hand is coming in, you can see the skin stretching. You can imagine that underneath your hands you're actually encouraging this propulsion of lymph fluid, taking it up into the direction that it needs to go. And honestly, this is much more comfortable for the person receiving. They feel more comfortable having the whole hand in place. It's more encompassing, it's more nurturing, and it's just a better experience for the client. Over recent years, there's been huge developments in the imaging of the lymphatic system. And in this photograph, or you're going to see the video of this shortly, this is what we call indocyanine green lymphography. It's also known as near-infrared fluorescence imaging. And what it has done is it's enabled us to identify any disruption within the lymphatic system. And as a result of this, it's also enabled us to identify the benefits of manual lymphatic drainage on the lymphatic system. So what you'll see from this first video is the movement of lymph through a vessel in the leg, and the very bottom part here we are looking at an ankle. Where you see that little black box, that's just the injection site of the dye that's injected into the tissue. The lymphatic system picks up this dye, and then the lymphatic system, you can see with that where it's extremely highlighted, how slow it is actually moving through the lymphatic system. It is moving, but it's moving at a slow rate. And again, that comes back to when we were talking about, a rate of around 6 times per minute. Then in the next video, we can see where somebody is actually performing manual lymphatic drainage, the hand at the lower part of the ankle. And you can see the increase in the lymphatic uptake and also the increase in the contraction of those lymphangians as a result of manual lymphatic drainage. So hopefully here you can see that manual lymphatic drainage really is enhancing the mechanical workings of the lymph vessels in removing that fluid far more quickly than what is normally happening in the body. Now, lymph movement is also supported by other extrinsic factors such as musculoskeletal movement, so the movement of body parts, arterial pulsations, respiration is also very key in moving the lymphatic fluid. But manual lymphatic drainage is one of the ones that we know, and we can see that through this visualization, thanks to these diagnostic tools, that we can actually support the movement of lymph using manual lymphatic drainage. So now I'd like to talk a little bit about inflammation. Inflammation is a big topic of conversation and has been for some time now. A lot of the conversation around inflammation relating to chronic inflammation, particularly chronic systemic inflammation, can be a precursor for many diseases that we come across in the modern world. But inflammation is a natural process. It is the body's natural healing process. It's attempt at self-protection and start healing. So whenever there is damage or trauma to the body, whether that be a wound, surgery, an infection, there's always that inflammation, and inflammation is the kind of infiltration, the influx of immune fighting cells and cells that heal tissue, and we get a lot of movement, a lot of activity in an area. So when you've got inflammation, we get that localized response. We get an infiltration of these leukocytic cells, which are obviously, again, your B cells and your T cells that are activated as a result of the trauma. It's like the little army is kind of called in to say, okay, we need some help. We get a lot of redness to the area. We often get pain. And often that pain is a result of the pro-inflammatory cytokines that actually come to that area to promote the healing. Swelling is common because, again, with inflammation, you get a vast amount of blood that's coming to the area because it wants to, get involved. It wants to heal. So I'm bringing that army. I'm bringing the soldiers. So bring in all the essential cells and nutrients for the start of that healing and repair. So as a result of that increased amount of dilation that we get from the blood capillaries, that means that we get more fluid to the tissues. There's also a lot more waste products as a result of that healing and repair. So the tissues get really full of fluid, and we need the lymphatic system to help remove that out so we can start to initiate that healing response. When you get that swelling and when you get that pain, you often get a loss of function to the area. And again, that loss of function is essential in protecting the areas from further damage, but also just loss of function just because of the trauma that tissue has experienced. There's a lot of talk at the moment about cytokines, particularly around COVID and that cytokine storm and that real large amount of cytokines that come to the area for healing. But when you've got inflammation, they are very important because they are initiating that healing response. But the problem is if they stay around for too long, then they create too much of a proliferation of more of these inflammatory cells. They create more collagen formation, which can overheal to a certain extent. So it's important that inflammation happens, but what we can do with manual lymphatic drainage is we can kind of reduce the intensity of that inflammation. And I'm not saying that the minute we get inflammation, we apply manual lymphatic drainage to immediately, get things moving. We want to leave these cytokines and we want to leave these cells in the area for a certain amount of time so that the body can heal. But if they stay too long, then we get more problems and it has a knock-on effect. So why don't we use manual lymphatic drainage to really enhance the movement of these substances out to promote further healing? So a recent article was published regarding the development and treatment of lymphatic dysfunction in cancer patients and survivors. And it was really eye-opening for me because it really helped me understand a little bit more about the immune response and inflammation with the lymphatic system. And it also just kind of created that, oh wow, people are actually talking about this now, as opposed to, it's been in our thought process for many years in the world of manual lymphatic drainage that it is likely that it supports immune function because we are moving lymphatic fluid. But I think we're seeing more and more research now about the role of the lymphatics and inflammation and the immune response. And so I'm really excited to see articles like this being put out there. And hopefully we're going to see a lot more. So with manual lymphatic drainage and inflammation, your lymphatic function is greatly mediated by any inflammatory condition. So when we have large volumes of these cytokines in the tissue, it can end up kind of decreasing lymphatic function. And without going into too much detail, I think I spoke briefly about nitric oxide earlier and how that can vasodilate the capillaries, and it increases the movement of your lymph fluid. But sometimes these cytokines can actually increase the level of nitric oxide, and if there's an excessive amount of dilation of these lymph vessels, it can result in the poor functioning of the valve, so it can often lead to some backflow. So it can change the functioning of these lymphangions in a huge manner. And so when we've got that long-term inflammation within these vessels, we want to try and create a better environment for that healing and try and reduce some of that inflammation. Manual lymphatic drainage is a great way to enhance the movement of these these inflammatory substances. And by providing manual lymphatic drainage, we can possibly reduce tissue irritation, we can reduce the pain, and just provide a general overall better healing environment. And one of the things that I do think is important to understand, though, that we don't provide manual lymphatic drainage immediately when there is inflammation. I think we need to allow the body to go through its initial process of healing, and that's allowing those substances to do what they need to do. They've come into that area to do that work. But what we can do is maybe we can support the lymphatic function surrounding, maybe more proximal to that area, to get the lymphatic system kind of kick-started and working. Remember, the lymphatic system doesn't have a pump. It doesn't have this mechanism that says, keep moving, keep moving. It can be sluggish, especially when people are experiencing some kind of trauma or they've had surgery where they're not as active and their lymph function isn't to its optimum. Because again, muscle pump action, moving the body, will help enhance the movement of your lymphatic system. So this is where manual lymphatic drainage can hugely benefit. But again, giving it 48 hours at least before you work anywhere near an area. And also, if you've got, wounds and surgery sites, you certainly don't want to be providing MLD there. But this is the benefit of manual lymphatic drainage, is that it can be worked in other areas that can support lymphatic function. So you have an indirect way of moving the lymph and supporting the lymphatic fluid. The other thing, going back to what we were talking about from that protein that ends up in the interstitial space, when proteins end up sitting in the tissue for long periods of time, it can create even more inflammation. It can also lead to the proliferation of other cells, such as adipose cells as well, causing more congestion and fibrosis within the tissue. So we can help with manual lymphatic drainage in returning those proteins out of the tissue spaces back to the cardiovascular system, which again, they're essential for human function, and we need them back. So when it comes to inflammation, I think there are more studies that we're going to see more studies coming out in the future around the role that the lymphatic system has, and hopefully more studies around the benefits of manual lymphatic drainage. There are a few of them out now that are accessible, but we do certainly need more. But hopefully what I've been able to present to you and kind of put into your minds a little bit is the fact that we can support this excessive amount of inflammation that people are experiencing. And without going into too many of the other factors of all the other systems of the body that are also working, inflammation that's systemic, that people have, like inflammation throughout the body. Again, yes, manual lymphatic drainage, by moving all of these inflammatory substances that are creating this undesirable terrain, we can move with our manual lymphatic drainage techniques and bring in a little bit more harmony to the tissues and creating a more healthier terrain for the cells and their environment. So when it comes to the cancer patient, the cancer client, the lymphatic system is always affected. And even if, you have a client that doesn't necessarily need surgery for their cancer, sometimes surgery isn't always indicated. Sometimes it could be just radiation. Sometimes it could be neither radiation nor surgery. It could be just chemotherapy. The lymphatic system is always impacted. And the lymphatic system from the point of view of immune function, as well as the point of view from fluid transportation. So, as we all know, often when people are diagnosed with cancer, sometimes they have lymph node involvement, which will mean removal of those lymph nodes, a lymph node dissection, or it will mean radiation and then some chemotherapy. But often damage to the lymphatic system can occur as a result of surgery or the radiation. And if this happens, this can often put the client at risk from developing lymphedema. Now, lymphedema is a condition that can occur as a result of poor lymphatic function, more often than not blockage of any lymphatic return. It's not to be confused with lymphoma. That's a completely different situation. Lymphoma is actually sarcoma or cancer of the lymphatic system. Lymphedema is a term that's used to describe the buildup of protein-rich fluid within the tissue spaces. So as we discussed, we're needing to pull this protein-rich fluid out of the interstitial space and get it back to the cardiovascular system. If the lymphatic system is not able to function effectively enough and keep removing that fluid with normal function, it can do that. But if we don't have normal function and it cannot be removed quick enough, the proteins end up staying within the tissue. And yes, you get edema, but that edema is full of protein, so it's known as lymphedema. So there's a huge difference between edema and lymphedema. And with lymphedema, this can be, it's a lifelong condition. It's not something that can go away easily. Hence, I am a lymphedema therapist, and I see many clients with lymphedema as a result of their cancer treatments. And it's an interesting and it's an interesting condition, not one that can be easily treated, but the best way to treat it is actually with manual lymphatic drainage and complete decongestive therapy, which is another topic of conversation maybe towards the end of this presentation. But you can see from this photograph in this slide that we have a client here that has had surgery, most likely breast surgery. You can see where the hand is below, that's where a drain has been put in place. And then we have that large surgical incision, and then we have a skin flap at the top. But this incision can diminish the lymphatic flow, particularly up towards the axilla. And you can see the upper part of this incision site is leading up into the axillary group of lymph nodes, extending through into the lateral trunk, down towards the medial aspect of the trunk in the rib area. So this, in effect, this person here may not necessarily develop lymphedema immediately, but certainly would be at risk because the scar tissue, and possibly, there may be a situation here where a lymph node has been removed, but certainly the scar tissue, that incision site, is actually following and is in the way of these lymphatic vessels that drain towards the axilla. So your scar tissue can definitely disrupt normal lymphatic flow. This is where manual lymphatic drainage can be beneficial because we can redirect that fluid around the lymphatic flow. The other thing to think of when you have a cancer client, and often some of the chemotherapy drugs that they have, or even just the pain medications that they take just to help alleviate some of their symptoms, can disrupt the digestive tract. And as we know, intense pain medications can lead to constipation. And when you do appropriate and effective manual lymphatic drainage, particularly on the abdomen, which is a very key part of the manual lymphatic drainage sequences, we can help support some of that, that disabled function of the digestive tract. But also pain medication can often give people disruption to their cognitive abilities. So again, we can utilize manual lymphatic drainage to help with pain management, and maybe the client won't need to take as much pain medication, which can again lead to better quality of life. And I think that's one of the things that we're also thinking of here with manual lymphatic drainage, is that we are supporting as best as we can good quality of life as a result of the treatments. And I know I'm not preaching to the choir here, in that you are all aware of the intensity that these people experience when they've gone through these cancer treatments. But any modality, and particularly manual lymphatic drainage, which is very gentle, supports the lymphatic system, can offer so much respite from some of these conditions that people experience. So the impact of scar tissue on lymphatic function can be huge. And again, what you're seeing here in this slide, these are some photographs of different traumas that and scar tissue that can actually affect lymphatic function. Again, not always necessarily you need to use manual lymphatic drainage just for your oncology client, because everybody can benefit from manual lymphatic drainage. But obviously with our oncology client, a lot of the time they've gone through surgeries, they've got scar tissue that's hugely impacting their lymphatic function. But we also have situations like where we get a sprain or some kind of trauma and we get a build-up of edema in the tissue. In this one, you can see that we also have a large hematoma. And this, in effect, can also disrupt normal lymphatic function, normal lymphatic flow, because the coagulation of the blood from the broken blood vessels can, form and thicken and harden and just reduce the movement of our lymphatic fluid. You can see from that scarring on the knee, this is somebody that's gone for a total knee replacement. We've got a lot of scarring, we've got the edema. In this area, we probably won't want to be working directly over this scar tissue immediately, but certainly we can work more proximal, and that's one of the benefits that I love about manual lymphatic drainage, is that we can always do the work. It doesn't necessarily have to be the area of concern or the area of trauma. We can do so much work more proximately, and then gradually over a period of time, we can then work at a more distal presentation, gradually incorporating all of the treatment that we need to get back normal lymphatic function. And again, when it comes to surgery and on the facial area, we do have a vast amount of lymphatic nodes in the face and neck area. And again, what we're always doing whenever we've got scar tissue, if there's enough scar tissue that's blocking the movement of this lymphatic fluid, we have ways of moving that fluid around that scar tissue, taking the fluid into proper functioning lymphatic vessels, so we can actually support the movement of the lymphatic fluid rather than it getting stuck in an area of scar tissue. When you have excess edema in the tissues, that can create a tension within the tissues that can ultimately drive further deposition of collagen. So again, if we have too much collagen and we have that dysregulation in the formation of collagen, then we're going to end up with even more scar tissue than we need. And I think it's also, we need to have that fine balance of how much do we want the body to heal itself, but how much do we also want to help and enhance the movement of the inflammation, so that we're not getting an excessive amount of inflammation or scar tissue formation in that area. Again, what I do want to reiterate here is that we don't always, we're not always able to work on the actual trauma site, the surgery site, wherever that scar tissue is, but we can certainly work proximal from it before even thinking about going to distal. The other thing with manual lymphatic drainage as well is that we can also use it on older scar tissue. So if we do have scar tissue that has been there for a longer period of time and we've got some restriction and there's some edema, I'm not saying it will fix it completely, but certainly with a combination of some scar tissue mobilization combined with your manual lymphatic drainage. I've done this in my clinic and I've often seen some very positive results. So you do have that option. So some of the benefits of manual lymphatic drainage in the oncology setting, like I've said before, it's a very powerful analgesic modality. We can reduce the level of pain medication that a client wishes to take. And again, this is not done through you and the therapist. This is always done between between your client and their medical team. But if we are able to introduce this stimuli that can have a positive impact on the nervous system, reducing those nervous responses, then why wouldn't we use it? If it means that somebody is more able to get back to normal quality of life and normal daily function because we're providing some level of pain relief, as opposed to them taking it with medication that gives them other side effects. I mean, there's no real side effects to manual lymphatic drainage other than that your client may need to use the bathroom more frequently. But there's no side effects to manual lymphatic drainage, and so that to me is, I'm all for that. So the analgesic benefit, then we've got the regulation of the sympathetic nervous system. So our parasympathetic nervous system is, our rest and digest, and our sympathetic is our fight and flight. Now, what happens is with manual lymphatic drainage is that we can deactivate that sympathetic nervous response, and we can activate the parasympathetic. And if we can activate that parasympathetic, that is a time when the body is ready to heal. We can't do much healing when we're in fight and flight mode because the body's just on alert the whole time and it's not being given the chance to recover. And a lot of the time, especially with our oncology clients, with the entire realms of the emotional aspect, the mental aspect, the physical aspect of their diagnosis and their treatments, they're often in that fight and flight mode constantly. And so how are they expected to heal as quickly and as effectively? So this is again where we can introduce manual lymphatic drainage to provide that stimulus to the parasympathetic. We can switch off that sympathetic, get rid of that kind of fight and flight all the time, and then just bring in that calming, resting and digesting of the body. So again, if we promote that parasympathetic nervous system response, we're going to enhance, their digestion. We're going to enhance possibly their sleep, their mood, their stress, their anxiety, the PTSD that they can often experience as a result of their cancer treatments too. And of course, as we just spoken, we can move fluid around blocked areas. Now, lymph node removal is also considered a major blockage of lymphatic return because your lymph nodes filter the fluid that it receives from these lymphatic vessels. So when you remove lymph nodes, you have lost some of the functioning of the lymphatic system. And I haven't gone into great detail about this because again, this is an introduction. But what we do have in the body is what we call watersheds. We have lymphatic watersheds. And these watersheds actually separate the regions of drainage from one part of the body to the other. So we, instead of, the fluid going all into one place, we have it sectioned off. It's almost like, if you can think about the continental divide here in the Rocky Mountains in Colorado, if you think about the continental divide and how the water and the tributaries from that divide, they either drain to the east or to the west. And that's how our tributary regions work within the lymphatic system. So when somebody's had, let's say, lymph nodes removed from an axillary region, and you may have witnessed this if any of you have been working with patients that have lymphedema or are at risk from lymphedema, then you may actually see that the arm or the truncal area is the area that swells up with the lymphedema and it doesn't travel to any other part of the body. And that is because these watersheds that we have stop that from happening. So they separate drainage pathways. So when we have a blockage of lymphatic return in an area, for example in the axilla, we are able to redirect over to another side of that watershed. We use our manual lymphatic drainage skills to move that fluid across from one region that's affected to another. So this is again where manual lymphatic drainage is pretty unique because there's no other way of doing it. The body doesn't do it on its own. Only we can do that with manual lymphatic drainage. So we have the ability to even reduce, we even have the ability to possibly reduce the formation of lymphedema if we were to provide manual lymphatic drainage early enough prior to any formation of lymph fluid in the tissues that can't be removed, and provide regular manual drainage to somebody that does have a compromised lymphatic system. And if we just keep things moving early enough, we have that potential to maybe prevent the formation of lymphedema within the tissues. So it's really, there are so many benefits to manual lymphatic drainage, but this is one of my favourite because I know how I can help people that are particularly at risk from lymphedema. So in this slide, this is giving you some indication of how we can move that lymph fluid across from one part of the body to another. And what you can see in this first one is this person has right upper extremity. Right upper extremity is the right arm. It's a term we use in the lymphatic world. But the right arm has the lymphedema, or is at risk from lymphedema. And the arm and the other pink area that you can see there is the chest area and the breast tissue area. That entire area, the lymphatic fluid from those areas actually drains into the axillary lymph nodes. So if we have somebody that's had, let's say, radiation to this particular area or removal of lymph nodes, that could then put somebody at risk or have developed lymphedema. So if somebody has developed lymphedema here, you don't want to direct the fluid into that axillary area. The lymph nodes are already compromised. We don't want to overload the system. So what we want to do is we want to move it away from that area. And what we do is we cross the fluid over from the right side over to the left and take it over to the left axillary lymph nodes. We can also take it down to the same side inguinal lymph nodes. And this is what we call redirecting the lymphatic fluid across the watersheds. And we call these anastomoses. And then the other diagram is just showing you that we have a lower extremity lymphedema, or somebody at risk with lower extremity lymphedema. We wouldn't take the fluid into the inguinal lymph nodes on that same side. We would redirect it and move it across to the other side. So we would then cross over the watershed on the middle of the line, which is known as the median sagittal watershed. We can then also cross the watershed that's at the waistline and move that fluid up into the axilla on the same side. So this again is one of the real important benefits of manual lymphatic drainage with your oncology client, in that we can help prevent lymphedema by just keeping the lymphatic system moving through these other pathways that we can utilise. Or if somebody does have lymphedema, we are able to manage that for them using our manual lymphatic drainage skills. So MLD in the oncology setting, we can, as I've mentioned, there are so many benefits to manual lymphatic drainage, but I want you to start thinking about how can we help not only with just pain relief and the movement of lymph fluid, but we can help with post-surgical recovery. We can help with edema reduction. So even if, let's say, somebody is at risk from lymphedema and they have to have another surgery, we can then provide MLD post that surgery to make sure that any edema that's formed doesn't get stuck as a result of the poor lymphatic function. So we can certainly help with edema reduction. And again, edema, if you have edema for a long period of time, it can cause restriction in the tissue. It can compress, on some of the nerve endings, causing more irritation and sometimes some pain. It can help with pain control, as we've discussed. Infection prevention, particularly localized infections. So one of the things that can often happen to people when they've had lymph nodes removed or radiated is they are at higher risk for localized infections such as cellulitis. And cellulitis is an infection of the skin, and somebody that develops cellulitis, it needs to be treated immediately, often with intravenous antibiotics, because it can become systemic. And again, you've got to think about if the immune function in an area has been compromised, such as lymph nodes being removed, because again, your lymph nodes are very important in the role of immune function, particularly in a localized tributary region, they're more at risk from developing an infection, and that infection can come from an insect bite or some kind of wound on the particular limb that has poor immune function. So we can help prevent that by just keeping that lymphatic fluid moving and keeping the movement of our lymph and keeping making sure that immune response is staying in top form. If there's a hematoma, we also have the potential to relieve the pain, discomfort and the pressure of the tissue from that hematoma. We can change the colouring. I've had a lot of success myself in the treatment of hematomas with manual lymphatic drainage. Constipation relief is another area that we can greatly help with manual lymphatic drainage from two perspectives. One we spoke about briefly when we talk about pain medication. If you can reduce the amount of pain medication that a client needs, that will then have an effect on the digestive system, because as we know, one of the side effects from the pain medication can be constipation, because we are just shutting the nervous system down to the point where we're not getting a lot of movement. But also in manual lymphatic drainage, one of the sequences that we utilize, barring any contraindications, which is another topic of conversation for another presentation sometime, but if you have access to the abdomen, we do some deep abdominal work when it comes to manual lymphatic drainage. And the deep abdominal work is so that we can have access to the deeper lymphatic trunks, but at the same time we are working over the colon. So the movement of our hands over the colon area can also help with constipation. Relaxation, stress reduction, helping with sleep, all of those parasympathetic nervous response, we really can have a huge impact on these quality of life issues. So with what we need to remember with manual lymphatic drainage is that we are introducing a stimulus that is not agitating, it's very calming, and as a result of that, I think that's where we can really encompass the benefit that we have with the parasympathetic nervous system. We are supporting every system in the body with manual lymphatic drainage as well, and we're also able to just bring a sense of peace and calm to our client too. So finishing up with MLD in the oncology setting, there are numerous of side effects that an oncology treatment can give to a client. So what we can do is just provide some symptom relief. Important to understand though that manual lymphatic drainage should be avoided over recent surgery sites, and particularly recent surgeries. And what's also very important, we have to be very mindful of somebody that's received radiation. Radiation can be very damaging to the tissue. I was once heard from a physician, a radiation oncologist, that radiation is that gift that keeps on giving. And it is true, because somebody that has radiation, again, some of you may obviously be aware of this, but radiation can have lifelong effects to the tissue. So we have to be mindful of that, and mindful of the fact that radiation can also disrupt lymphatic flow. So when we've somebody that's had radiation, MLD can be very beneficial because we can redirect the fluid, but we really have to be mindful of the area of radiation. One of the other things I want to mention as well is that with, if somebody's receiving chemotherapy or intravenous medications, any other form of intravenous medications, please don't think about providing manual lymphatic drainage for at least 48 hours post, because we don't want to interfere with removing those medications out of the body too quickly, and we don't want to make anything create a reaction. So contraindications must always be considered. Always stay up to date with the client's lab work and the functioning of the systems that actually process that lymphatic fluid, and I think that's a very important thing to remember when we're using manual lymphatic drainage on the oncology client, because a lot of the oncology drugs, as again you're all pretty much aware of, but they can affect the functioning of the cardiovascular system and the kidneys, and therefore if we are returning fluid with manual lymphatic drainage more quickly than the body's used to returning that fluid, if the system that's receiving that fluid isn't functioning correctly, we can cause more problems, and that's certainly something that we don't want to do. So that brings us to the end of this presentation, and we have our last polling question. And that question is, which of the following should be considered when providing MLD on an oncology client? Number 1, awareness of areas with blockage or damage to the lymphatic system. Number 2, the radiation sites. Number 3, surgery sites. Or number 4, the name of their oncologist. So the answer is actually, well, there's 3 answers to this question. The awareness of areas with blockage or damage to the lymphatic system, radiation sites, and surgery sites. All 3 of those are important considerations when you're going to be providing manual lymphatic drainage on your oncology client. You don't really need to know the name of their oncologist unless you need to refer out to them or contact with them for permission to do your manual lymphatic drainage. But definitely having an understanding of what cancer treatments can do to the patient, to your client, and the impact of those treatments. And again, it's not necessarily the actual treatment itself; it's the side effects from the treatment. So I think we all need to be, whatever body work we do, whether it is manual lymphatic drainage or oncology massage, acupuncture, any of those modalities that can support our oncology client, I think it's always important to have an understanding of what we can do safely. And that brings me to manual lymphatic drainage being a very safe modality as long as we know the contraindications. And I really am excited because I do feel that there'll be more and more research as the years go on into the benefits of manual lymphatic drainage, not just for our cancer clients, but also for the general population. Thank you for joining me. I hope that you found this presentation to be helpful, inspiring, informative into the world of the lymphatic system, and I would love to answer any of your questions when we have the questions and answers section. Thank you.